Okay, hi, we are Group 10A from Section C, and this is our presentation on radical belonging in healthcare. So just a little bit of background to start. Fairview is a nonprofit healthcare delivery system, and it is based in Minnesota. So they have a huge network. They have hospitals, clinics, pharmacies, and many other things, and they're all focused on providing compassionate care. Hope Commission is a commission that is part of the Fairview system, and they are trying to bring about more equitable outcomes and inclusive environments and experiences for everyone involved. So, patients, employees, and the community. We were given a case, as you all know, and it was made up of various healthcare team members. They all had unique backgrounds, identities, beliefs, and careers, and we were to come up with a solution for just the issues that are facing the team.
So, in its simplest definition from sociologists Hurtado and Carter in their 1979 work, looking into Latino students, the idea of belonging is the feeling of connectedness to a larger group or community that allows an individual to feel as if an integral part of the system. This could be in a social, cultural, or professional sense, amongst other forms of groups. As elucidated in numerous studies, the sense of belonging amongst healthcare workers is essential in increasing workplace satisfaction. However, there is much variability in how belonging is defined. In a study by Gordon et al. In 2022, evaluating belonging amongst healthcare workers in a large urban teaching hospital in the context of the COVID-19 pandemic, three aspects of belonging were defined: ethnocultural or identity-based, workplace or economic-based, and mental illness-based. When attempting to define belonging with the effort of changing the system to improve the feeling of one's acceptance and support from a group, the idea of radical belonging comes up. As described by a paper by Luli et al. In 2022, this definition involves the key elements of transformative change and communal experience stemming from collective action, in addition to the combined social, academic, and democratic belonging. With those ideas in mind, our team puts forth the definition of radical belonging as the following. The idea of fostering connection between individuals and their greater community by actively promoting inclusion of ethnocultural self-values, workplace needs, wellness, and openness to continued improvement within the aim of allowing them to feel as an integral and fully functional part within the system.
So, why does belonging matter in healthcare teams? First of all, it's no surprise or no new news that healthcare workers are leaving the field at an alarming rate. This is especially prevalent since the COVID pandemic started. With this comes staff shortages and an additional strain to the financial health and just the overall culture of the organization. The remaining workers that are left are being overworked and underpaid and are suffering from compassion fatigue. So, as Nina said, belonging is just that sense and feeling of connectedness and being cared for by others. So, belonging actually has a huge impact on the performance and retention of team members. If you feel that you belong and are connected to your work, you're able to bring your authentic self to work. And that allows you to share ideas openly, confidently speak up, and fully contribute to the team's success. It also allows for collaboration, problem solving, and better decision making, all of which we know are important in a healthcare team where interprofessional communication and collaboration is the utmost importance to the team's success. A sense of belonging unlocks the power and value of diversity, and it really just allows the team to succeed fully. And it allows people to actually enjoy their work and be engaged. According to a study by the Modern Health Society, a sense of belonging can increase performance up to 56%, reduce turnover by 50%, and result in 75% less sick days. So, really, it can help to avoid a lot of the issues that we talked about in the beginning and can help avoid compassion fatigue and just keep the team stronger and better able to provide for their patients.
So, our team has made a couple of recommendations to support the building of radical belonging within the health organization. So on an organization level, there are a lot of things from the perspective of the hospital administration can do to support their employees, and from another aspect, like continue to provide great patient care during this very stressful time of the pandemic. So, first thing is definitely childcare, food, transportation assistance for families that are in need within the employees. Hospital administration listening sessions is another very important suggestions that we'd like to put forward, since it is important to understand the employees' concerns in the beginning and then put forward corresponding solutions. And another way to support our employee on an organizational level is to mobilize community support of healthcare workers, because we have seen many local communities providing food, restaurants bring in desserts for healthcare workers. That's on the news during the COVID-19 pandemic. And we think that this level of connectedness with the local community that we're trying to serve will have a great impact on the employees and the healthcare workers. Another concern that was brought forward in the case was employees feeling conflicted about explaining masking and social distancing policy, as well as vaccination to patients in the family. So we would like to put forward strict masking and distancing policy within the hospital, just to ease some of the mental stress. Further education and additional training programs for employees is another way to help retain employees and have them have a better career prospect and continue on their promotion and expand their work scope as well. Nonetheless, besides the frontline workers, doctors, nurses, therapists, pharmacists, there are non-essential workers, but still very important to the operation of the whole hospital, like administrators, like also the front desks. They can have they can be better kept safe from the pandemic by working from home. So we would like to provide them that option as well. On a team level, for the treatment teams, we would like to suggest open discussions during handoff or huddle, either daily or weekly, on how to best support each other, because sometimes there are needs that was just not communicated openly, but with the help of each other and across the different specialties, we can probably come up with better solutions to better provide patient care. And next thing is that since it's during a pandemic, there are always emergencies, let it be personal, families, that we like to provide the employees with the option of having more flexible scheduling and help them better balance their work and home life, as long as we're not compromising patient care. And lastly, support group for marginalized identities. Many marginalized communities are experiencing, discrimination or racism during this difficult times for some of the some rumors or conspiracy theories, and we would like to provide the support to those people as well. On an individual level, weekly work hour limit is, we know that it's a very stressful time for everyone in the hospital, but not to compromise patient care and also to take care of our mental health and prevent burnout. We think that it's a very important policy to put forward.
In order to reach a wider audience, we will make sure we are hosting job fairs in various areas that may have been affected by COVID-19 in different ways. We will host the job fairs in higher and lower income communities to spread awareness and reach a larger audience. We will also provide options of work from home and in office to accommodate individuals with different health concerns. We will make sure we are working with our workers that have been impacted by COVID-19 to ensure a stable work environment and positive health outcomes. We can also work to provide free services for individuals who have been impacted by COVID-19, such as at-home testing kits and nearby testing site addresses.
So the implementation steps that we as a team could do would be forming a plan. We could create a way to maybe create like a meeting or like a group where people who have been affected by COVID-19 can come and like just talk with others who are also like going through the same thing. We can implement a strategy. So the team will try to get someone who has been impacted by COVID-19 to come maybe a few times a week just to talk with others, because it's better to be with a group and work through things with others instead of doing it alone. We could evaluate the results of this to see if these groups are actually helping others work through the impact of COVID-19, and then we can just modify and make sure that the group meetings are working. And the short-term goals of this are just having these COVID-19 group meetings a few times a week and just making sure that they're helping. And then the long-term goal would be just that the team will continue to help people that have been affected by COVID-19. And this could be like patients that we're seeing, or it could also be like employees in the hospital as well that we're trying to help, like with burnout and things like that. And then how will the team support this? They will just help these individuals that have been impacted by COVID-19 get the help that they need, just to make sure that they have someone to talk to or just anything like that.
So for metrics of success and how we're going to evaluate the outcome of all these recommendations that we have put forward, the most important thing is definitely the retention rate of staff due to all the stressors during the pandemic from work and from life. Whether or not that we can keep our employees working at our organization through the sense of radical belonging will be a very important criteria that we'll use to evaluate. During this process, we don't want to create too much of a burden, for example, in having an employee come to meetings that they would rather use to relax or dealing with family emergencies. So we'll also assess the average work hour per week across different departments. Ours is a specific department or specialty severely overworked. How can we do to improve that and better distribute the work more evenly? So staff satisfaction will be another derivative of that. So we'll conduct surveys, understand what the staff and employees suggest that we can improve to create a better retention rate. And lastly, we would not want to compromise patient care while we're trying to retain our staff and provide better benefits. So patient satisfaction and also patient outcome will also be very important metrics of success.
So, although the case study does mention that patient volume and short staffing have made daily workflow a lot more taxing and time consuming, having, like we said, hospital administration listening sessions is key to fostering a more inclusive, accepting, and open environment for healthcare employees. So this can be a sustainable way to be able to make sure that we have everyone on board as a team during this difficult time. So like we said, having weekly meetings, possibly around the lunch hour with even mental health support and specialists available can ensure that people can voice their concerns, questions, and be able to listen to others' experiences and challenges within and outside even the workplace. We believe that this could foster a sense of community and connection within the team, as people may start realizing that despite having very different backgrounds, many of their concerns, worries, and emotions during this challenging time are shared. A literature review from Hungary in 2021 during COVID stated that several studies have found strong relationships between employee satisfaction, organizational commitment, and loyalty. And some also stated that employee satisfaction is negatively related to turnover and absenteeism. So with such a high rate of turnover in academic hospitals such as SLU, with med students and resident teams even changing sometimes weekly, it's important that we manage and be able to sustain such a dynamic workforce. So it's important that each new team member entering this environment understands the concerns and challenges within the existing team. So a suggestion could be having each new resident and medical student be required to attend a listening session as part of the onboarding process to the new team. This could be really important because it's really important for them to understand what the current team's challenges are and concerns are to better connect with and work closely with the team. This will continue to sustain and foster an open culture of acceptance, accountability, and empathy within the healthcare teams. Additionally, speaking on more of this, maintaining a sustainable, flexible work environment, having brief team meetings during even shift sign out can help employees discuss emergency shift changes within the team. This can helpfully sort out any schedule conflicts or transportation problems, caring for sick loved ones at home, or important medical appointments that employees might need to make, and alleviate some of the conflict of absenteeism that can decrease workplace satisfaction and impede on sustainability of this program. So these ideas can be implemented across a variety of workplaces, from big corporate businesses with many employees to even small local businesses. The idea is that each corporation, healthcare team, or small business needs to prioritize employee well-being and maintain an open environment for communication of conflicts, concerns, and even mental health topics. This includes making a conscious effort to have frequent team meetings, possibly with even mental health specialists or support representation and support groups for the BIPOC population in the workplace to ensure that people feel heard and build a sense of community and belonging with one another.
So now to speak a little bit about what we learned during this whole project. So while working in a interprofessional team consisting of students in medicine, pharmacy, physical therapy, and occupational therapy, we learned about the different specialties that are involved, their roles, and the unique perspectives that everyone can bring to the table in regards to patient care and the healthcare system overall. And by focusing on open and honest communication, we were able to work efficiently together as a team. And the biggest thing from this project is that we learned about how vital a sense of belonging is to different aspects of our professions, including mental health, job satisfaction, burnout, and patient care. And I think I can speak for all of us that as we continue on in our professional careers, that we'll continue to promote radical belonging so that we can improve the healthcare system for everyone involved.